Hello, ladies and gentlemen. My name is Regina Pates, and I'll be reading a peer-reviewed journal article titled Coping, Reasons for Living, and Suicide in Black College Students, taken from the Journal of Counseling and Development, published October 2012, by Mi Wang, Pius Ningtu, and Kimberly Tran. The purpose of this study was to examine the role positive factors, namely coping and reasons for living, in protecting against suicide among Black college students. The findings indicated that these factors have an influence on suicidal behavior in this population. Resources for living were especially found to have a protective factor against suicidal risk, which aligns with prior research with college students. With regard to coping, the findings indicated that emotion-oriented coping mediates suicide risk negatively, whereas avoidance-oriented coping protects from suicide. One possible explanation for this finding is that emotion-focused coping strategies, more commonly used by Blacks, is often related to elevated feelings of hopelessness, which in turn increases the likelihood of suicidal behaviors in Black college population. Greater use of emotion-oriented coping strategies may veil individuals' beliefs that they can conquer the stressors and associated distress in their lives. In regard to avoidance-oriented coping, the protective nature against suicide may be attributed to the diversion of an individual's focus away from the presenting problems and perhaps toward meaningful things. For Black college students can often observe their peers and gain different perspectives and potential solutions to their problems. The implications of this study are important because they expound on the factors after suicidal behaviors among Black college students. As noted earlier, although there is a minimal research on this population, suicide has been reported as the third leading cause of death for both Black male and female teenagers, also young adults. In addressing suicidal behavior in this population, counselors need to incorporate interventions that promote increased reasons for living. Past research has already indicated that college students with higher levels of suicidal ideation have fewer reasons for living, whereas those without suicidal ideation have a greater sense of responsibility to family and friends, as well as a stronger coping belief system. Mental health professionals working with Black college students should strive to help clients identify and acknowledge specific purposes for life because this may help to alleviate depression, which is already known to be a predictor of suicide. And other reasons for living that may be stressed may include attraction to life, fear of suicide, repulsion by death, moral objections to suicide, survival and coping beliefs, and a sense of responsibility to family. Such increased reason for living may help to mediate between stressful life events and suicide. Prevention programs are also a useful meaning of addressing suicide behaviors among students, such as Black college students. And it's proposed that they are most effective when implemented in a large-scale systemic level that includes the entire university. Thank you. It's been my pleasure.